Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the slow virus diseases. So this includes, they are characterized by the long asymptomatic period, asymptomatic period, and they are characterized by often months to years in duration. So they can be months to the years, and between the introduction of infection agent and the appearance of the clinical illness. So they are classified into group A, B and C. So what is group A? Group A slowly progressive infections of the sheep. So it includes the Visna, VISNA, as well as the MEDI. So VM. Next is we move on to the group B. So what is meant by group B? Group B is it includes the prion diseases. So prion disease is included in group B. So they can be the scrapie, the mink encephalopathy, as well as the bovine spongiform encephalopathy. Then moving on to the prion disease. The prion disease of the humans, it includes the CJD, the Kuru, as well as the Gertzmann, GSS, that is a Gertzmann, Strassler-Schenker syndrome. So GSSS and the fatal familial insomnia. So all this comes under group B, fatal familial insomnia. Next we move on to the group C. So what is meant by group C? It is nothing but the SSPE as well as the PML. To learn and grow daily like this, please do subscribe.